quick. We're just gonna, you guys have been hearing about the ROTA. You've been hearing about the CSAT team and the ROTA grant. It's a regional operation that they're doing. So they have come to share and talk about that. Before they do, real quick, I'm just gonna lay the, just really quick, lay the groundwork here. ROTA stands for rural. So rural is a big focus of this group. And substance use is a public health crisis in the rural. If you look at the top 10 priorities, they're in the top 5, the 2020, like 2020, 2030, healthy people, 2000, you've heard, healthy people, 2020, 2030. Rural healthy people is sort of a companion, a document to that. And they identified substance use as the top priorities ahead of heart disease and stroke. So it's a big one that is really common. Access is their #1 priority being identified. So I know you're starting to see this link now, how nutrition education can work with these folks. Stigma is a big issue. Majority of rural residents with substance use using outpatient medical care are not participating in AA, NA, or any mutual self-help groups. This is a big problem in rural communities. The stigma, right? In here, 2.3 million people, if I have a substance use issue, I can go to NA right down the street and walk in and nobody's gonna see me, right? But not in a small community. So they tend not to go. And that's a big problem. But guess what? They'll go to nutrition education programs. And so there's a lot of people in your programs, if you're teaching nutrition education or SNAP education, that have substance use issues that may or may not be getting treated. So less than 10% attend those meetings and less than 10% attend specialty treatment. Almost 30% will attend an outpatient medical care. So for physicians, great opportunity to work in the outpatient, and then also food banks, nutrition educators, dietitians. It's just a great sort of way that we can partner with these folks and really make a positive impact on substance use as well as nutrition education. And there's tons of studies on this last one that nutrition education, particularly with a substance use treatment focus, is associated with positive outcomes in treatment outcomes as well as nutrition. So we know this to be true. Many individuals in recovery are rural, low-income, food insecure, and SNAP eligible are receiving them. More than 65% of SNAP participants are families with children. 63% are young women, basically non-elderly women. 61% of households with children were headed by a single adult, 91% of which are women. So we're seeing clearly that this is an audience that we should be working with and partnering up with. And then 1 in 8 children under 18 in the US are living with households with at least one parent with substance use disorder, and single mothers are at the highest risk for this. So I just wanted to kind of show you that link there before they come up, because this is a fantastic partnership between USDA and SAMHSA, and reaching these citizens really requires a collaborative effort in terms of making a difference in a holistic approach. So if we don't, we can weaken the collaborative system, the holistic approach, if we don't partner together. So with that, I'm going to pass this over, and they're just going to share with you some resources they have that you may be interested in, and they represent our whole Western region.
Hi, everyone. Again, my name is Trisha Dudkowski. I'm a project manager with the Pacific Southwest ROTA-R. So you can see I'm going to be talking a lot of acronyms, so I do apologize in advance. The Pacific Southwest ROTA-R is housed at the Center for Application of Substance Use Technologies, which is CSAT for short. CSAT is out of the School of Public Health at the University of Nevada, Reno. And CSAT offers, we're fully grant funded. We have about 50 employees, and everyone is working on either SAMHSA grants, CDC grants, state, we manage the SOR dollars, so the state opioid response dollars. We also have a collegiate minor program, and we also offer services on campus. So CASAT is doing the good work in Nevada, and ROTA is just one part of what we do at CASAT. Again, SAMHSA is our funder for ROTA. This funding cycle is 2 years, and hopefully we hope that another grant cycle comes out next year. So Region 9 comprise of California, Nevada, Arizona, Hawaii, as well as the Pacific jurisdictions. With ROTA in particular, we focus on 43 rural counties. So we do offer services for education and TA for all of Region 9, but we do focus primarily in the 43 counties. At CASAT, we have had the ATTC, the Addiction Technology Transfer Center, for 30 years. So SAMHSA grants are they're not new to us. What is new for this grant, though, is that our partnership with Leah's Pantry and Annie Lindsay with the Cooperative Extension Office, that is really what is very different from the ROTA grant and other SAMHSA grants that we have. We also work with the Region 9 ATTC as well as the Region 9 PTTC, which is the prevention group. And then who am I missing? Region 10 ROTA. So that is the Northwest. So I wanted to focus primarily on 3 activities that we did in our year 1 funding cycle that really brought substance use education and our Leah's Pantry SNAP educators. We did have an in-person training. We brought, I believe, 35 SNAP Ed implementers to Sacramento and gave them a presentation on nutrition, food security, and support, essential information about women and stimulant use in rural communities for our SNAP Ed implementers. So this was a full day training. These SNAP Ed implementers got education from Dr. Annie Lindsay, also from Beth Ratowski, who is a stimulant educator out of the Region 9 ATTC that's at UCLA. Leah's Pantry also did part of the presentation. So we really brought all of this, these collaborative partners and trained the 35 SNAP Ed implementers. We are also creating you can see here, a self-paced online course for SNAP Ed education implementers. So again, this is not for participants. This is for the people that are offering services to the participants. So they have a better understanding of stimulant use, opioid use, and just emerging drug topics in those areas. The online course, or the self-paced online course, will be active in 2024. Oops, go back. Oh my gosh, there we go. Okay, this series is something that CASAT has been doing. So we call them Enhanced Professional Learning Series. What they are multi-week education series. So rather than having people come to a 1-day, a 2-day training, we provide online training for an hour and a half for multiple weeks. Some of our series are 5 weeks, some of them are 9 weeks. And the understanding is that all workers learn and all learners work. So we don't want to take people out of their work environment. For many of our people, it's a loss of billable hours. And so people don't really have the time or really the resources to be able to go to full day training. So we offer this EPL series. We have a lot of topics, but this one in particular is Healthy Living, Sustainable Recovery. Dr. Annie Lindsay teaches that for us online. And we've actually been working on that EPL series since about 2019. It was originally with Dr. Lindsay's Healthy Steps for Freedom program. And so we have developed it into a more broad general subject matter in nutrition and stimulant use disorders. So we've only offered this once for the Pacific ROTA-R, but we are planning on offering it more times. And so these EPL series, again, are just ways for people to get more education on different trainings. In 2024, we do plan on offering a trauma-informed approach in behavioral health and mental health settings. And so we are working that for next year. I wanted to put up a couple of our past webinar topics. So you can see a lot of so this two-part training series on opioid and stimulant use in rural communities. All of these webinars followed up with a consultation about a month after our live webinar. So the live webinar, it's a pretty passive way to kind of learn about a topic, but we did offer some TA, a 1-hour session where people could come in, meet our presenters for our webinars and ask them questions directly. So it really is, just an informative session for whatever it is that people need. I wanted to showcase all of these because they are available online as recordings. And Michelle will tell you how to get get access to them. But we are bringing some new webinar titles in 2024. I think we're looking at some cannabis, a two-part cannabis series, and some harm reduction. So there are many opportunities for education from the Pacific Southwest ROTA-R.
Hi, everybody. I'm Michelle Solomon. I am actually a licensed drug and alcohol counselor by trade, and I've been in all levels of treatment and mental health for 20 plus years. And now with ROTA, I'm actually newest to the ROTA team in February of this year. And I am responsible for kind of some content creation for our website and some products. So what I'm really doing here, bringing in the tail end of the day, is I want to show you guys where some of the resources Tricia just talked about are available online, and let you know that how she just talked about the webinars, the different classes, the webinars, soon online courses are available to you or your staff to sign up free of charge. You can go back, view the webinar, obtain the PowerPoint presentation. So I just wanted to bring you to, and we have to pass out, if you would like, some cards with our website. So this is just our main page. And I wanted to highlight just two things here quickly. One of the unique things we've created that has come out of ROTA is through a needs assessment, we have found that in our rural regions that Annie talked about, one of the barriers is just access to treatment. And we heard from a lot of our stakeholders, we don't know where to send people for treatment. We know they need treatment, we don't know where to go. What we did here is, I don't know how to use this red light here, is if you go up here under resources, and then you'll come down here, we have developed a searchable database of the Western states that we're responsible for and the Western jurisdictions, even to the point that you can put in a county down here. And you can go look for what treatment is available in that county. And for us, because of our grant, it's specific to opioid treatment centers, OTPs, or buprenorphine medical providers. And these are physicians specifically that will treat opiate use disorder. And that was a very small number a while ago. And because of a new waiver being taken away, that the ability to prescribe buprenorphine is going to expand greatly. So this is a real moving database, a real-time database, so you can go and search. If you're looking for other levels of treatment, though, we do have on our last page, we can direct you to the SAMHSA treatment locator. And I don't know if folks in this room are familiar with that, but that is a great interactive tool. You can go to any state, any county, look up what level of care you're searching for, and they can give you a list of what's available there. And then a couple of the products we've created through ROTA that we have found a need for specifically for our populations. The first one is just a harm reduction poster. Somebody spoke about this earlier, just the stigma around harm reduction. What is it? It's more common than we think in our everyday practices with things like sunscreen, seat belts, life jackets. And we really want to normalize what is harm reduction specific to substance use. So we have this poster, and then the newest two we have created are in regards to the medication naloxone. And I'm sure most of you guys are familiar with what naloxone is. Brand name is also Narcan. And this is a opioid overdose reversal medication. And we unfortunately all know we are in the middle of an opioid epidemic, and more recently a fentanyl epidemic. One of the presenters this morning talked about we're even changing the language from overdose to poisoning, because what we're seeing in high numbers in rural too is people that are buying drugs off the streets, black label or black market drugs, they're almost all contaminated with fentanyl at this point. So back to harm reduction, we have things like fentanyl testing strips, different harm reduction techniques that we try to help teach clients and patients ways to keep themselves safe. But back to our posters, we're really trying to normalize access and saturation of naloxone in our communities. So just like we would have an AED on a campus for sports, or just like we would have a fire extinguisher in a public building, this medication can save lives. And the good thing about naloxone is it is safe. If I wasn't sure what was happening on my daughter's campus, I just did a presentation for her middle school, and the teachers are scared. I don't want to give this medication, I don't know. It cannot hurt you. If you think this is what's going on and you administer naloxone, which is just a nasal spray, kind of like Afrin, it's not going to do any damage to somebody that's not having an opioid overdose. So this, I mean, the numbers of lives this have saved alone in Clark County. So we're really trying to normalize naloxone and having that and having access to that. And the last product we created is some informational brochures on opioids and stimulants specifically. And there's a lot of this literature out. We can find it easily. What we did is we tried to make it specific to rural areas. How can they access treatment? How do their barriers to treatment look different for opiate use disorder and stimulant use disorder? And we actually have two versions of both of the trifolds. We have a provider version and we have a consumer version. And the only difference is the provider version is a little bit more medical heavy. These are intended and were created for something like a lobby that you could put these out, give them to your clients, your patients. And then lastly, I think we have, and I should have started my presentation off by saying we had a huge box of all of these supplies coming here, and it's not here until tomorrow. I guess the first box got lost in transit. So we're gonna have all of the products here for you guys to take if you want any of them. And the last thing I wanted to show right here is on our website up here, you can go order any of these products. We can mail them to you free of charge. We have magnets for you guys to take that will direct you to our website and where to order our products. And we do have our business cards that have the QR codes. And we also have, I think Trisha was going to talk about, we created a toll-free number. And this is actually a number that rings to one of us. If you guys have any kind of question related to substance abuse, we can direct you where to go. If we don't know the answer, we'll figure out where we can send you for questions related to substance abuse, specific to rural or not rural. So I think that's it. Yeah. Thank you.
All right, so that concludes our presentations. We are now going to move to that side of the room behind the dividers, where we'll have dinner